Ulcerative colitis is a lifelong condition, but with the right care, most people can live full, active lives. Ulcerative colitis causes ongoing inflammation and small ulcers in the inner lining of the colon and rectum. Doctors classify UC by how far inflammation spreads, from the rectum only, to the left side, or the whole colon. UC follows a pattern of flares and remission. A flare brings diarrhea, blood and stool, urgency and cramping. Doctors diagnose and monitor UC using blood tests, stool tests like calprotectin, and colonoscopy with biopsies. Treatment has two goals: calming an active flare, then keeping the disease quiet with long-term maintenance. From mild to moderate disease, guidelines usually start with 5 ASA medicines like mesalazine, taken orally or given rectally. For stronger flares, doctors may add steroids short-term or step up to immunomodulators, biologics, or newer oral medicines. Surgery is not needed for most, but removing the colon can effectively cure the bowel disease when medical treatment fails. Daily habits also matter. A balanced diet, managing stress, good sleep, and avoiding NSAID painkillers can reduce flares. Long-term follow-up includes blood tests, calprotectin checks, and surveillance colonoscopy starting 8 to 10 years after diagnosis. Most people with UC work, travel, and start families. Pregnancy is usually safest when the disease is in remission. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.